Have you been told that you suffer from chronic systemic inflammation? Have you been told that this is injurious for your health? I'm Dr. Rawat, a physician with decades of experience who coaches clients on the reversal of metabolic disease. And today, I'll be telling you how to reduce chronic systemic inflammation in 5 steps. Make sure you watch the video till the end because the 5th step may surprise you. First of all, what is chronic systemic inflammation anyways? To understand that, we first need to understand inflammation. There are 2 types of inflammation: acute, meaning short term, and chronic, meaning long term or persistent. Acute inflammation is normal. In fact, we need it to survive. If you injure yourself, if you bang your knee, for example, it becomes red, hot, swollen. That's a form of acute inflammation. When you get an infection, your body mounts a response. You get a fever. That's also an acute inflammation. However, you would expect that once the infection has been cleared, the inflammation level goes down. Similarly, once the knee is healed, you expect that the swelling and redness also goes down. So acute inflammation, which is normal and is required for us to survive, which is our immune response to injury or infection, is a short-term body response to external challenges like injuries and infections. However, the expectation is that this will settle down to a baseline. The problem arises when it does not settle down to a baseline. And if you use markers like CRP or C-reactive protein to measure your levels of chronic inflammation, you may have a high CRP during a time of injury or a time of infection. However, you would expect that to go down. And the widely accepted level is that the level should be less than 2.0. If the level never goes below 2.0, that suggests that there is something that the body is continuously fighting. Your immune response is continuously on the offensive, trying to fight something, and that's where you're suffering from chronic systemic inflammation. In my coaching program, I coach on the reversal of fatty liver, insulin resistance, hypertension, obstructive sleep apnea, polycystic ovarian syndrome, metabolic syndrome. Many of these conditions are inflammatory. For example, when you have hypotoxicity, which means poisoning of liver cells by excessive fat cells in the liver, that causes damage of the liver, and as a result the body has to try to repair that damage. And since this is happening chronically or long term, that leads to chronic inflammation. So many of these conditions are inflammatory. In fact, the primary cause of many of these conditions is excessive ectopic fat, or fat where it shouldn't be, particularly visceral fat around the belly and also fat within the organs, more than 5% fat within the liver or excessive fat within the pancreas. And these are what cause insulin resistance and metabolic syndrome. And fat in itself secretes inflammatory cytokines like IL-6. And so excessive body fat in itself is inflammatory. So as you can imagine, the first step of reducing chronic systemic inflammation is to simply lose weight, particularly lose belly fat around the belly, which will lead to reduction in fat deposition within the organs. And how would you do that? Well, to lose fat, you need to be in a calorific deficit. I've done over an hour of content on my channel on how to lose weight. But to summarize, there are mainly 3 ways of attaining a calorie deficit. Number 1 can be to eat as clean as possible, as often as possible. So eating whole, intact foods, avoiding ultra-processed foods which are more calorie dense, focusing on those foods which are more nutrient dense is one way of reducing the calorie intake. Another way of reducing calorie intake is to intermittent fasting. If you squeeze your eating window into a shorter time period and fast for anywhere from 12 hours to 18 hours in a 24-hour period, naturally you'll be able to consume fewer calories over a shorter period of time and will end up being in a calorific deficit. And the third way of entering into a calorific deficit, and of course you can do all of these 3 things to varying degrees, and what I find on my coaching program is that I get some clients who love fasting, others who are very strict with their diet, and others who would rather have a if it fits your macro approach, where they don't really care so much about meal quality or meal timing, but they're able to count their calories accurately and stay in a deficit. It depends on your personality, but the long and the short is that if you're in a calorific deficit, your body will utilize stored energy, it will burn your fat, and you will lose belly fat. The second thing you can do to reduce chronic systemic inflammation is to follow what's called an anti-inflammatory diet. And this includes swapping certain types of food items for alternatives which are known to be less inflammation causing within your body, as long as you're not specifically allergic or intolerant to those food items. Some simple swaps would be replacing bad fats, and these are mostly red meat, deep fried food, solid fats like butter, ghee, lard, coconut oil, and palm oil, with omega-3 unsaturated fats like fish, seafood, nuts and seeds, olives and avocados. For carbs, this would be replacing refined carbs such as cookies, pastries, donuts, Timbits, bagels and cakes, white rice, white bread, and cereals with whole intact grains like steel-cut oats, millets, quinoa, sourdough rye bread, brown rice, etc. For protein, this would be swapping red meats for fish and marine sources of protein, as well as plant sources of protein, including soy products, beans, legumes, lentils, chickpeas, etc. For dairy, this would be replacing solid fats like butter, ghee with fermented probiotic dairy, including kefir, paneer, yogurt, soft cottage cheeses, etc. For drinks, this would be replacing sodas with green tea, black coffee, fermented drinks like kombucha or lassi, which is a liquid yogurt. For snacks and drinks, it would be replacing your chocolates, candies, pop with nuts and seeds, dark chocolate, and the occasional small glass of red wine. Replacing liquid fructose, which is in fruit jams, fruit juices, fruit marmalade, fruit ice creams, with actual whole fruit, and replacing excessive salt with more spices, including turmeric, cumin, black pepper, etc. Also, just generally increasing the amount of fresh fruits and vegetables or produce will be anti-inflammatory, because these contain various types of anti-inflammatory agents. Essentially, those various colors within the vegetables, like the purple anthocyanin and the orange beta-carotene, are all anti-inflammatory antioxidant agents which have been shown to reduce risk of cancer, reduce risk of heart disease, etc. It's also important to change your cooking style, because it's been shown that high temperature cooking and also excessively burning your food, and this could be deep frying or char grilling your food, can be inflammatory for your body. This can lead to advanced glycation end products and advanced lipoxidation end products, essentially toxins from high temperature cooking which lead to inflammation within your body. Number 3 way of reducing chronic systemic inflammation is by paying particular attention to your gut health. In our gut, we have over 38 trillion bacteria which have various roles within our body. They are involved in the production of many hormones that we require for metabolism, weight control, sugar metabolism, and even mood. And following a diet and lifestyle pattern which benefits your gut microbiome is beneficial. This includes increasing the amount of fiber in your diet, increasing the amount of fermented foods, which can include fermented dairy like kefir, yogurt, paneer, soft cottage cheese, but also other food items like kimchi, kombucha, sauerkraut, miso, tempeh, homemade pickles, as well as increasing plant proteins and omega-3 fatty acids. The kind of food which are detrimental for the gut microbiome include refined sugars, saturated fats, and ultra-processed foods. Intermittent fasting has been shown to be beneficial for a more diverse gut microbiome as well. Some of you may be curious as to what role probiotics have. I see probiotics as seeding your lawn. You don't need to seed your lawn 12 months in a year. But if you do wish to seed it a few months in a year, then that's completely reasonable. The main thing you need to do is through diet and lifestyle, which is weeding away the bad bacteria and making the soil fertile for those good bacteria. But perhaps every few months, if you would like to use a probiotic, then that is certainly a reasonable thing to do. On my website, healthgroupcoaching.com, I do have a blog called Top Supplements and Probiotics for Gut Health and Metabolism, in which I do write about all of these things. And there are certain types of prebiotic fibers, as well as specific probiotic, which have been shown to reduce cholesterol, aid with weight loss, improve metabolism, fatty liver, and help with some other specific conditions like bacterial vaginosis and irritable bowel syndrome. So you're more than welcome to check out my blog on that topic. But again, if you use a lawn analogy, if weed have been growing in your lawn for many years, if you're now finding yourself in a situation where you've gained weight and have become metabolically unwell because you've been following a poor diet and lifestyle for decades now, it'll take some time for you to be able to weed out those weeds and plant new, more healthy microbiome in their place. The fourth method of reducing chronic systemic inflammation is by improving sleep. Whether it is an overall lack of sleep, and we do recommend 7 to 9 hours of good quality sleep per night, or disturbed sleep, perhaps because of environmental factors, bladder problems, chronic pain, stress and anxiety, or whether it's because of obstruction to the breathing in the form of obstructive sleep apnea. All of these things have been shown to not just increase blood pressure, increase sugar, lead to metabolic syndrome, but also increased levels of chronic systemic inflammation. So particularly if you snore, it's really important to get a sleep test done and rule out obstructive sleep apnea. If you have bladder problems, chronic pain, anxiety, depression, make sure you consult with your physician and get those things controlled, because inadequate sleep is a major contributor to metabolic health. And finally, number 5, the fifth way of reducing chronic systemic inflammation is by reducing chronic stress. Many people may not realize that they are suffering from stress. They may be having other symptoms, perhaps migraine headaches, irritable bowel syndrome, breathing difficulties, but what they in fact have is chronic stress. And when your body is in a constant state of fight and flight, when your stress hormone levels like cortisol are always increased, that naturally leads to increased chronic systemic inflammation. It also has a knock-on effect on everything else. It leads you to eat more calories, eat more unhealthy foods, take part in more unhealthy activities like smoking or drinking excessive alcohol, and also makes you less likely to participate in healthy activities like going to your physician for a checkup, following a healthy lifestyle and diet, going to the gym, exercising, etc. So chronic stress is really at the center of all of this. If you don't manage that, then everything else can go out of whack. So identifying it, seeking help is really important. Apart from medication and therapy, other options can include mindfulness, meditation, breathing exercises, journaling, etc. I coach in a program on reversal of metabolic disease on my website healthgroupcoaching.com, and this is my blood test for checking my levels of inflammation. As you can see, I had non-existent inflammation. The CRP reading is less than 0.5, and if you read there, you can see that CRP above 2 is a risk enhancing factor for cardiovascular disease, meaning heart disease, as defined by the American Heart Association and the American College of Cardiology. And so I would urge you to listen to what I'm saying, not just because of what I preach, but the example that I set. If you've ever had a CRP level done and it was above 2.0, then you should be making efforts to follow the guidance on this video. There is one more aspect of chronic inflammation that I would like to touch upon, which is called infla-aging. Chronic inflammation means that your rate of aging is faster. And in a sense, if you reduce inflammation, not only do you reduce your risk of heart disease, but also slow down your rate of aging. And this is one reason why I don't check CRP levels in clients above the age of 60. because as we get older, the amount of inflammation does go up. And in most of my clients above 60, they would have a CRP above 2. And so it is deemed not necessary, or in a sense futile, to check CRP levels above a certain age. In fact, I'm 46 years old now, and it's frankly rare to see clients even of my age with a CRP of 0 like I had. Why does inflammation go up as we get older, you might be wondering? That's because there are certain things which happen in our body which are associated with aging, which are all inflammatory. As we get older, we tend to gain more fat, particularly around the belly. We tend to lose our muscle mass. Our joints become more worn out and arthritic. There are certain changes which occur with our immune system. And there's also a theory that whatever toxins we've been inhaling or ingesting or drinking, whether these are microplastics, heavy metals, the kinds of colorants, preservatives we find within ultra-processed foods, over time all of these things would naturally accumulate, and mostly these are accumulating within your fat cells, and that can also lead to increasing inflammation. And so it is but natural that reversal of aging and reversal of infla-aging or reversal of inflammation would require a reversal of all of these things. You would need to reduce your fat mass, increase your muscle mass, adopt an anti-inflammatory diet, reset your gut microbiome, reduce stress, improve your sleep, adopt a clean way of eating, reducing exposure to toxins, and supplements such as omega-3, prebiotics and probiotics may also play a role in reducing levels of inflammation. In certain studies, even the act of consuming refined sugars and saturated fats has been demonstrated to spike your levels of sugar as well as spike your levels of fats, which leads to an inflammatory response within the body. On the converse, practices like intermittent fasting or letting your body rest, just like adequate sleep, has been shown to reduce those levels of inflammation. Ultimately, whether it's fasting or sleep, your body has inherent ways of fixing itself. Sometimes we just need to step aside and give our body some time, some space, an opportunity to get the repair mechanisms up and running. I hope you found the video useful. If you know anyone else who's suffering from chronic systemic inflammation, then do send this video to them. Subscribe on the channel for more videos. Consider signing up for my coaching program on healthgroupcoaching.com. If you'd like to watch more videos to improve your health, then click on the videos and I'll see you there.